Hello, my name is Richard Granger. I'm the former Director General of Information Technology for the National Health Service in England. I was appointed in 2002 by the government in the UK to lead their major investment programme in healthcare IT, which was launched by Tony Blair in spring 2002. I've been given the opportunity by Dr. Gabriela Villarreal, who leads the comparable program in Mexico, to say a few words of introduction about the program in Mexico and things that are going on globally as part of this video. Firstly, I'd like to say that the modernization of healthcare is dependent upon information about patients, information about facilities, information about pharmaceutical products, and information about equipment. Modernization of healthcare is dependent on information being available. I call that information liquidity. In the last 20 years, most people in Mexico have gone from dealing with banks exclusively using pieces of paper to having an ATM card and going to a machine, putting it into the machine, and withdrawing money and undertaking other transactions. And it would be unthinkable to revert to a situation where the only way of getting money was to stand in a queue in a bank. For most people working in industrialized settings in Mexico. Clearly it's different in the rural population. In the banking sector, therefore, you can see significant increased liquidity of information. You can find your balance online, you can find it at an ATM machine, you can find it by using the telephone. A situation in healthcare in many countries is fundamentally different. Information is not available. Even if somebody can get hold of a doctor with information, the file may not be with the person, maybe in the record store. Test results aren't available quickly. Diagnoses are not available when the patient moves from one institution to another. So this information illiquidity drives very significant inefficiencies and also generates a significant level of error in most health systems in the developing and industrialized world. Now, I find it interesting to be in Mexico, where you have the opportunity to jump over, to leapfrog a number of other countries with your healthcare IT activities. And to the north of here, the outgoing President of the United States claimed that by 2015, all US citizens would have an electronic health record. In a separate presidential decree, he claimed that there would be a manned landing on Mars in the same year. Well, the pundits in the US tend to think that the manned landing on Mars is more likely than the electronic health record for every US citizen. Now, I think the outlook in Mexico is actually much more positive. I think with a society that actually places significant value on its citizens and recognizes their rights and needs, there is a higher probability of achieving electronic health records for the majority of Mexican citizens over the next 5 to 10 years. And the initiative which Salud has launched in the last 12 months has made very good progress. Several pilots have been undertaken and indeed completed. A number of studies have been undertaken about costs, and a number of design exercises have been undertaken. And part of the conclusion of these exercises is that there are good things already in place, be it with IMS, be it the National Identification System, and there are significant barriers around network connectivity and the availability of IT across the country. So it will be necessary over the next 2 to 5 years to focus on the construction of infrastructure, of standardized record keeping, and training personnel to start to use computers as a regular part of their day-to-day working lives within the health sector. That's going to be quite challenging for people that currently rely on paper. It's going to be disruptive in terms of how they organise their working lives. There's going to be a significant need for training. There's also a series of sociological barriers to introducing IT in healthcare. Information redistributes power. So where previously somebody retained information and in effect had a captive patient relationship, as the information starts to flow with the patient, then the patient starts to make more choices. And one aphorism I've heard used to describe this is IT in healthcare not only introduces efficiencies and improves safety, it can also change the relationship between the doctor and patient from being deferential, where the patient defers to the doctor, to being referential, where the patient will refer to the doctor but will have a much greater involvement in decisions around their healthcare and ultimately have much better health outcomes because of that involvement. And when one looks at the morbidity data in Mexico, you can see several epidemiological phenomena around, for example, alcohol consumption, where the only way of dealing with that major cause of morbidity in Mexico is involvement of the patient, and information can assist greatly with that. So I commend the program which Salud is running to you, and I suggest that you start to think about upgrading of your infrastructure, training of your staff, awareness and communication as part of the preparatory tasks as this program gets rolled out across the country. And I sincerely hope that as I revisit Mexico over the next few years, I see the people in this country start to get the benefits that healthcare IT can give them in terms of information about their test results, their diagnoses, and the availability of services becoming freely available to them, and that these benefits are realised across the country, most especially in the areas where there are significant health inequalities as a consequence of an absence of infrastructure at the moment. So thank you very much for listening to me.